So the special tests are there. So these special tests are helpful to identify the what are the major we are going to identify the incoordinations, and also who are having the equilibrium or not. We are going to identify with the special test. So these special tests, these coordination tests are there. So these are going to be the non-equilibrium test and also equilibrium test. Two classification, two types of the test. So these tests, the two tests are going to be, the first one is equilibrium test. So these equilibrium tests are consist of the finger to nose test, finger to therapist finger, and also finger to like a therapist finger test, and finger to finger test. Coming to the is a Diadochokinesia, and also rebound phenomena, heel-to-shin test, and also buttoning and unbuttoning test. So these tests are called as the equilibrium test. So these special tests to identify the if anybody having any incoordinations, so we can easily identify with the special test. The first one is the finger to nose test. So in the fingers to nose test, so with this test we have to ask the patient. So patient should be comfortable in the sitting positions, and also should be abducted 90 degrees, and also elbow is extension. The patient asked to bring the tip of the index finger to the nose. So if the normal persons, so they can touch the like a finger nose exactly. But who are having the abnormalities or who are impaired coordinations, so if anybody get any injury in the cerebellum, so if you ask the touch the nose, so they are going to be difficult to find the nose where it is, or maybe they are unable to find the exact distance between the finger and also nose. So they are going to get the shivering and also shaking. So this is the indicating of the incoordination, or because, and also is indicating the impairment of the coordinations. And coming to the next one is going to be the finger to therapist finger. So if the therapist should stand or sit in front of the patient, so ask them to hold the touch the therapist finger. So ask them to touch, if the therapist finger is here, so ask them to touch the directly to the therapist finger. This is the normal response. Who are having the incoordinations, or maybe the hypometria or a hypermetria, so they're unable to reach the finger exactly. Either maybe they reach or cross the finger, or maybe they may reach the hypometria. They're searching for the fingers here. So because they're unable to find the finger here. If the normal person, if you ask them, so they are going to directly touch the finger here. This is the normal coordinations. So this is the rhythmic movements, and normally is going to touch the therapist fingers. So this is about the finger to therapist fingers. And also another variation of the finger to therapist finger also. So also are maybe therapists or doctors. So here is going to ask the patient to alternate touch the tip of the nose and also tip of the therapist finger. So here the therapist is going to be like a doctor, a therapist is going to stand in front of the patient. The patient has to touch the nose, as well as next one is going to has to touch the finger. Touch the nose and touch the fingers. Touch the nose and touch the finger. So this is the normal. So who are having abnormality, so unable to reach the nose and also unable to reach, not properly reach to the toes. So this is the special test to identify the any disturbance in the coordinations. And also next one is the finger to finger test. So finger to the patient fingers. So ask them to do the abduction of the both hands. So bring it in the midline. So ask them to do the touch the other fingers of the patient. So he has to hold and also bring them into the shoulder abductions, and also bring it the extension, elbow extension. Ask them to touch the patient fingers, the patient finger to the patient finger. So this is also another special test. So another one is Diadochokinesia, and also is Diadochokinesia. Just now we discussed in the symptoms. So who are having the cerebellar injury, so they may chance to get the alternate, unable to do the alternative movements. So that means if you ask them to do the supination and pronations, so this is the normal movements. But in case of cerebellar injury patients, they are unable to perform the alternative movements. Either this is the supination and pronations, or maybe we can ask them to do the asking them to open the any knob, any door knobs. So ask them to twist towards the clockwise and also anti-clockwise. So if you ask them to do the anti-clockwise or clockwise, unable to perform the alternative movements. So that's, and also one more thing, we can ask them to tap the foot and also up and down. So these things are going to be so difficulty who are having the abnormality or who are having the impairment of the coordinations. And also we can ask them to another test for the Diadochokinesia or Diadochokinesia. So if you ask them to do the syllables, so ask them to repeat it with alternative, so unable to perform it. So the syllables are difficulty repeat the syllables. So these are the especially commonly observed who are having the impairment of the eye coordinations. So it's also called as Diadochokinesia. So coming to the rebound phenomena. So just now we discussed. So rebound phenomena means if we give the resistance to the any movements, if we give the resistance to the elbow flexions, so if we take out, if you remove the resistance from the elbow flexions, so may slap the face. So because of the unable to control the movements. So this type of the signs we can observe who are having the ataxia or in case of the like a cerebellar injury patients. Are in the not only giving the elbow flexions, we can give the resistance to the, for example, if you give the rest, like a, for example, if you do the flexion of the shoulders. So in the long axis, if you give the resistance to the shoulder flexions, if you give the resistance, after some time, if you remove the resistance, automatically the hand is going upwards. So unable to control the movements. So it may use the the overhead movements. So this is the uncontrolled movement, also called as a rebound phenomena. So another test for the to know the coordination is going to be the either heel-to-shin test. So heel-to-shin test, if you ask them to, if they ask the patient to drag the right heel over the left shin, so that is shin is nothing but over the tibia and the leg. So if you ask the drag from the toes from here, if you drag from the shin, that means from the ankle, if you drag from the ankle over the shin, so normally they can, who are having the normal coordination, they can drag easily over the like a shin of the tibia. But who are having incoordinations, they are unable to drag straight in the same directions. So may the heel may comes to the lateral side and one time it goes to the medial side. So it's if you drag from here, so it goes sideways and it comes this side cannot drag straight way. So that is called the shin heel test. So this shin heel test is a measure of the coordinations and maybe is the abnormal if there is a loss of the motor strength, or maybe is the proprioception, or in case of the cerebellar lesions. So both are the cause, like means the causative factors for the, I say very abnormal, negative or positive shin heel test indicating the muscle strength, loss of the muscle strength, loss of the proprioceptions, that is that which is also called as joint position sense, or in case of the cerebellar injury. So if the motor and sensory systems are intact and an abnormal asymmetric heel to the shin test is slightly suggestive of an ipsilateral cerebellar damage or cerebellar lesions. So who are having the motor function is a normal, sensory function of the normal. If the person is unable to perform this shin heel test, so if any positive shin heel test, it indicating the ipsilateral cerebellar lesions. So here I would like to explain one more important point here. So compared, if you see the cerebellum and also cerebellar, in the last class also we discussed the cerebral. If the damage in the cerebral hemisphere, right side cerebral hemisphere, the symptoms are going to be happening to the left side of the left side of the body. So because of this right brain, right cerebral hemisphere controls the left side of the functions. So for the left side of the brain is control the right side of the body parts. So, but it's going to be like a different, totally different to the cerebellum. So the right cerebral hemisphere, cerebellar hemisphere controls the right side of the body. So which means if any damage in the right cerebellar hemisphere, so it may give the loss of the balance and coordination towards the right side. So same side is going to be affected. So that means, so for example, if the person is unable to do the shin heel test with the right leg, the right heel not dragging over the left shin, so it indicating the right cerebellar hemisphere damage. So if the lesion in the right cerebellar hemisphere. So that is the main indication. So that those are the some special tests we are going to identify the cerebellar injury in case of the in case of the ataxia. The other special test also we have to assess properly buttoning and also unbuttoning test. So just now we discussed, right? Who are having the fine movements. The fine movements should be like the small muscle should be is functioning properly. Who are having the weakness in the spine, the small muscles, so they're unable to open the button and also unable to close the buttoning. Buttoning and also unbuttoning is going to be difficult, especially who are having the a cerebellar impairment. So these are the some special tests. That is, those tests are called as the non-equilibrium test. So that means the patient is going to perform in the sitting positions or standing positions, and also maybe in the lying positions.